All right, welcome everybody. This is our November 2025 um, support group. I'm going to say support group because we could have more than just moms. Usually I call it the mommy meetup support group, but the topics that we've had lately, anybody can join. Moms, dads, grandparents, honestly, people who aren't even parents. Some of this information is applicable to everybody. So I'm going to go ahead and start with our announcements. I'm going to make this full screen. Okay, give me a thumbs up, Sister Pat, if you can see that. My screen. Okay, awesome. Thank you. All right.
Yes.
So again, welcome to everybody. I think most of the moms that we have on here are our regular moms. If you are a new mom and this is your first time attending a support group, welcome. We're so glad you are here. We do a monthly support group. It's typically virtual, and then we lead up to the in-person support group. So if you attend the virtual support groups, then you qualify for the in-person support groups, which we really love. And typically we do two a year. We had three 1 year because we did a cooking class in January in person. But typically it's two in person a year. July, right before the kids go back to school, because we do a back to school giveaway. And then typically the last month of the year, December, we do Christmas. And if you've been attending these support groups, then you qualify for those giveaways. Those are just a little bit harder because we have all the kids come. So we have to have childcare, food. It's just a lot of work that goes into in person. So if you come to virtual, you will qualify for those. But this is a safe place for moms, parents, individuals to meet, to connect with community resources, to get the support you need. So even though we're virtual, we hope that you find some sense of community here and you know that you are not alone. You are loved. The whole idea behind everything that Shelter from the Rain does is to make sure you feel the love of God, make sure you know that you are loved. So we do that through our diaper bank, our pantry, our support groups, and our 6 month mentorship program. All of those things are accessible on our website, shelterfromtherain.com. You can sign up for the support groups and the mentorship program. And if you need help with household items or food or baby supplies, you can sign up on the website as well. I will be in the diaper bank this Wednesday if you need help before Thanksgiving. And we will have, if you sign up now, we will have grocery gift cards if you need those as well. All right. So our quote for the day is take the time. Hold on, let me let somebody in. All right, take the time today to love yourself. You deserve it. And I like to talk about self-care, self-compassion, especially with parents or caregivers, because a lot of times when you're caring for other people, you don't think about time for yourself or things you need to do for yourself. And it could just be taking a breather, taking a minute for yourself first thing in the morning or at the end of the day. Doing this now is also taking time to learn more information about how to take care of yourself. There's going to be a lot of information in this session that will give you more resources to help take care of yourself and potentially your family. If you don't need these resources, definitely share them with other people. But make sure you come back to this thought today. Do something, at least one thing, just for you today. Even if it's a very small thing, do something for yourself. You deserve that. All right, so we always like to provide an opportunity for parents to get to know each other. So if you want to type into the chat, if you want to connect your name, I got some people that come in. Your name, the ages of your children, and then your email or phone number or both. Definitely put your email because I try to email everybody after this and connect the moms or parents who want to connect. And your main need. Is it just that you want to have like play dates? You want to have a text buddy? If you're looking for a job or looking for a daycare, whatever your main need is, because some of the moms might see your question and answer it right now, or they might text you an answer to your question right while we're meeting. So if you want to connect with a mom, definitely put your information in the chat. You don't have to put your full name. You can just put your first name if you feel more comfortable with that. But definitely put your email that you want people to connect with. And if you're okay with putting your phone number, put that in. You can send encouraging messages. You can plan play dates, or like I said, you can do resources. All right. Okay, and then I always mention Savannah on the Move. They're on Instagram. If you want to connect with other groups, they work out. They usually do a walk slash run, and then they go meet for brunch. But they have been open to us inviting our moms if you want to get together for health and wellness. I'm not really sure when the next time they're meeting. I haven't seen a post recently, but they could be meeting this month, and I'm not sure if they're meeting next month. But you can find them Savannah underscore on the move on Instagram. All right, so our Christmas tradition, our 15-year anniversary is coming up on December 7th. And for our OG moms, our original moms, you know that you can come to this for free. For our new moms, we are opening this up to all of the families that we serve. You can come for free. You can bring the kids. It's a great family event. Our kids come, the moms that are in our program, we cover the ticket, we cover drinks and popcorn for you and the kids. One ticket for all of those things. So if you want to come to that, it's a great live show at the Savannah Theater. If the kids have never been to the Savannah Theater, it's a great opportunity to expose them to live theater. I will put that link in the chat once we get done. So you can RSVP, just let us know how many tickets you need. We'll have a list. So when you get there, you'll go pick up those tickets at the family table. But we need to know ahead of time if you're coming and how many people, so we can stop it after it gets to a certain point in terms of seating and popcorn and drinks. Does anybody have any questions about the Christmas show for anybody who's not familiar with this?
I can't see anything, but I can hear Miss Jennifer.
Okay. All right, cool. You can't see anything? Did somebody say they can't see?
No,
Jennifer, did we email you to RSVP for the play?
No, there's a link that I'm gonna put in the chat. Can y'all see the screen?
Okay.
It's Magda. The internet is not working. I had to do one of those call numbers. I can
Okay.
hear everybody, but I cannot see the screens.
Okay, can all the other moms, can everybody else see the screen? I know Sister Pat could because she told me she could. I can't hear any of the other moms, but there is a
Yes, we
screen.
can see.
Okay, awesome. Thanks. So
So
that
I'm listening.
I'm sorry,
I
I'm
can
watching
hear.
this.
Yeah.
I can see it.
okay, thank you. Okay, no problem, Magda. Just listen and then
Okay.
hopefully it'll come up later. But I'll put something in the chat. If you need to email me because you don't see the link in the chat, you can email me. If you're attending today, then you qualify to go to this for free. Just email me if you do not see it in the chat later. We're going to do it after the
Yes,
presentation.
ma'am.
But like I said, y'all can come for free. This year will be a little different for the people who have been there before. They're going to do the Christmas tradition show, and then they're going to do a Christmas Carol contest. There's 5 people competing for this contest. So that's the only thing that's really, really new. We're going to have a few other new things like in the lobby, like a 360 photo machine. We're trying to get out there. So it'll be a few things that are a little different just because we're celebrating 15 years of Shelter from the Rain. Otherwise, everything else for the people who are returning is the same. Let me turn this up a little bit. I'll light in my face. Okay. All right. And then the applications are closed for our Hope for the Holidays giveaway. That will be on December 13th. So I can't take any more applications. We've already submitted that to LifeBridge Church. We have 27 families that we will have there. So we had to cut it off. And I asked for those in October. Thank you for sending those. We won't have a virtual support group. It'll just be this support group for these 27 moms. So if you're not a part of the 27 moms, just come to the Christmas show that we're going to have, and that'll be the only meeting we have in December if you're not a part of the 27 moms who applied. And I will email the moms who did apply and were accepted this week. So you should get an email from me telling you the details of what we're going to do on December 13th if you applied. I think everybody who applied got accepted. So if you're like, oh, did I get accepted? Everybody who sent form in, I believe, has been accepted because I don't, unless I missed somebody, we only had 27 that came in. So you should get an email from me if you filled out that form telling you when time to come on December 13th. Does anybody have any questions about Hope for the Holidays? Okay.
I have a question. We can bring our kids, right?
Absolutely. Yeah, so that anytime we meet in person, it's open to the kids. So that little baby girl you see at the top, the Life Bridge Church takes them to their own separate section, and they usually do arts and crafts or something with the Life Bridge Church volunteers. So that's why I said I'm gonna send an email. Everybody who's on that list, I'm gonna check and make sure, are you bringing the kids? Some moms don't want to bring the kids because they're getting the gifts and they don't want the kids to see the gifts. Like some of our babies still believe in Santa Claus. Now they wrap these gifts up in trash bags, so you can't see what anybody's getting, and they're all wrapped gifts. But some moms don't like for the kids to even see that they're getting the gifts from there. So I will send an email. I will confirm whether you're bringing your children or not. I might even have a different form for you to fill out because we have to purchase food and we have to have enough volunteers for childcare. So you can definitely bring the kids, and the kids love Life Bridge Church. If you talk to any of the moms who've done this before, the kids have a great time. Life Bridge Church does a really, really good job of interacting and engaging with them while we're meeting in a separate room. But we do a lot of Christmas photos, as you can see. Like we like to do holiday photos together. And then the kids, like I said, they go play with their other friends and with Life Bridge Church. That's a good question for new moms, though. You can bring the kids for sure. Does anybody else have any questions? Okay. If you have anything else or you can't come off of mute, just put the questions in the chat. I'll check the chat once I get off and Sister Pat is speaking. All right, so today I'm very excited. We have Sister Pat from St. Mary's Community Center speaking to us about all the services that they offer. I'm really excited about this. This came out of one of our services and programs committee meetings. We wanted to have more partnerships with organizations in the community that help our moms. And they have a lot of services that could help you all. And like I said, if none of these are helpful for you, or if they are helpful for you, share them also with other people. So after we talk today, if you can let us know something new you've learned, something maybe you didn't know that they offered, and then I'll do the survey link, and then I'll also do the link for the Christmas RSVP. So do the survey link first. If you've done this before, it's very quick, very easy. We just want to know what was helpful for you. Are there any other topics that you want for 26 so we can like set up meetings around what you're interested in. And we've done that before. We have moms that were interested in autism resources. We've done that based on what the mom said. And then we do some other like mental health, financial literacy, other things that we typically do. But if you have anything new that you want us to cover, put that in the survey link. Like I said, the Christmas moms, we will meet on December 13th. And then we won't meet again with all of our families until January 24th in terms of support groups. Now, again, even if you're not coming to the December 13th, you can still sign up for the December 7th Christmas show. That's really, really for the kids, for everybody. So if you want to come to that, just sign up when I put the link in the chat. Before I end, does anybody have any other questions? I'm going to hand it off to Sister Pat. Okie dokie. All right, I'm gonna share yours, Sister Pat. I hope I didn't close out. I have so many screens. 1 second.
This is why I'm glad you're doing it.
I know. And I always think I have it because I have both of them ready together, but I probably should have took them apart. Ah. All right, let me just open it back up in a different oh, because I have it all ready to go. Let me make sure it's not in. Okay, no, it's not. All right, 1 second. Let me just pull this up again. All right, I got it.
Hello?
Can you see that, Sister Pat?
Yes.
Okay, great. I can move to the next slide.
Yes. Thank you. That's
Mhm.
great. All right. Well, good morning. Or is it still morning? Yes.
Yeah,
Good
it
morning, everyone.
is.
Good morning. So I was delighted to see all those babies. That's a real true gift. So thank you for that blessing this morning. I am the director of St. Joseph Candler's 2 free community centers, but we also have 2 free health centers. So I want to tell you about these outreach programs that St. Joseph Candler has, because I believe you all will surely be able to use some of these things. And just so you know that everything that we do is free. So I always say it's the right price. Okay, so St. Joseph Candler has 2 free clinics. Good Samaritan is located out in Garden City, and St. Mary's Health Center is located in Midtown on Drayton Street. Both of them are primary medical homes. You can see their hours, and Jennifer is going to put all of this in an email or something to you, so you'll have these going forward.
Yeah.
Okay, Jennifer. So they're primary medical homes. So they take care of almost all your needs. So it's the place that you go whenever you don't feel well. So no matter what it is, whether it's, I think I have a sinus infection, or I have a really bad cough, or I'm having really pains in my side, or I found a lump in my breast, all of that, all of those kinds of things, you go to your primary medical home. These are the people who truly take care of you. At St. Joseph Candler's 2 primary medical homes, your providers get to know you. You see the same person over and over again, and they know you and you know them. They are your, as I said, your listener, your caretaker. They do all the referrals for you. They advocate for you. You are theirs, and they take excellent care of you. So no matter what it is you need, they're going to make sure they refer you to the places that can help you the best. And you are a part of the team. So it's not things they do for you. They do everything with you. So you're a part of the conversation, and you help make the decisions for your care. Okay, Jennifer. So let's look at some of these care. Now, remember, I said free. So when you make an appointment and you need your blood drawn, all of that is free. If you need to have an X-ray or an ultrasound or an MRI, your provider sends you to either St. Joseph or Candler, and all of that is free. Jennifer? If you need medicines, medicines are a crucial piece to help us improve our health. So we have several options. Now, let me just digress here for a minute. And I forgot to tell you this piece. So to become a member of the free clinics, there basically are two requirements. The first one is that you are uninsured. You have no insurance at all. You don't have Medicaid, Medicare, or anything else. And your yearly income is less than 200% of the federal poverty level. And Jennifer, I can send you a copy of this year's, or anybody can Google it. Just Google 200% of the federal poverty, FPL, federal poverty level, and all of that will come up for you.
Right.
Now, these things about medicine that I'm going to tell you, these are all easy if you're in the clinic, but if you have other insurances, if you have Medicaid, or if you have any other kind of insurance, you could take advantage of these partners that we have. So this is really important. MedBank is another not-for-profit organization in our community. They have a huge database of almost 500 pharmaceutical companies' assistance programs. So even if you're more than 200%, up to 400% of the federal poverty level, you can get discounts on name brand drugs. Name brand, not generics, but name brands. So MedBank is accessible to everybody up to 400% of the federal poverty level. And Jennifer, I can email you the information, or you can just look up MedBank on Google and get the phone number and address, and they are extremely happy to help you.
Yeah.
The other one is called Good Pill. Good Pill is only generic medicines, but they have hundreds of generic medicines. So it's a company, a not-for-profit company out of Atlanta, and they send the medicine directly to your house. You don't even have to go to a pharmacy. It's a mail-in. So you send your prescription from your doctor. It's $6 for 90-day supply. So that's pretty great.
Yeah.
People who are in the clinics get some free samples through Direct Relief. Sorry, we can't give it to everybody, but we don't get that many free samples, so they go to our people. But please know, everybody know, MedBank and Good Pill are available to everyone.
Mm-hmm.
All
Yeah.
right.
I just want to add to this part, like, again, if you don't need this, keep this information for other people. This is a very difficult time right now for a lot of different families. I have a friend, and her partner lost his job this week. Like, they're laying off a lot of different people. So a lot of people who don't even typically find themselves in these situations of not having healthcare coverage or whatever, between now and January, there may be a lot of people who need this type of information. So when we get done, screenshot Sister Pat's information. Even if you don't feel like you need it now, you might need it later, or you might meet somebody who has some needs that we're talking about, and you can just text them her information and they can get in contact with her.
Okay, something really great that St. Joseph Candler is able to do is to provide specialty care for the patients of the free clinics. So these are all of the specialty care we have. Last year, we had 91 different doctors who offered free, no charge at all, for all of these services. So, and I just want to give you a couple examples here. So if you are having a heart issue, your provider is going to send you to the cardiology group. Everything they do, if you need a heart monitor to test your heart out, during the week or something, everything is free. We have, we're going to get into the eye clinic and all. So if you look at that, that's pretty extensive. So, just like even people who are paying for health insurance, specialty care is hard to get because there's so many of us and so few specialists in the Savannah area. And because St. Joseph Candler and really truly HCA now, they're no longer just Savannah hospitals, they're area hospitals, they're regional hospitals, because so many of the rural hospitals have closed. We are seeing more and more of the rural population coming to the coast to get healthcare. So you absolutely will get care. It just sometimes takes a couple of months. But, I'm one to tell you I needed a colonoscopy and it took me 5 months to get it. So it's not because people don't care about people who are uninsured. They absolutely do. We have wonderful, wonderful doctors who truly believe that healthcare is indeed a basic human right and nobody should be without it. Okay,
Well,
Jennifer.
Sister Pat, so they don't have to live in Chatham County to get these services.
No, ma'am.
Awesome. Okay, great.
So as long as all of these services are free, if they are a part of the free clinics.
Right. Okay.
Okay, so if by, a terrible thing happens and you have to be hospitalized, St. Joseph Candler writes off all of your hospital bills. Suppose as you're a member of the free clinics and you develop a hernia and you have to have surgery. The doctors will do your surgery, so your surgeon will not charge you anything for your surgery, and St. Joseph Hospital will write off your surgery operating room, and the anesthesiologist will write off your bills. So it will cost you zero. Free means free. Okay. St. Joseph Candler has a huge, very reputable, expansive cancer center, Lewis Research and Cancer Center. All of the patients who come to Good Samaritan or St. Mary's get free cancer screenings. So you see all the screenings on the list there, but it goes beyond that. St. Joseph Candler has made a promise. If they do the screenings and you are detected with cancer, they will help you with cancer treatment through the end without cost to you. Huge, huge.
Yeah, and
Okay.
that's big because even if you have insurance or if you've had health issues before and you can't get insurance at a rate that you can afford, that's huge. And I just want to emphasize this is really, really, really important because some of this information could save someone's life. Like a lot of people are like, oh, I don't have insurance and I can't afford what I really need. So then they just suffer and they just continue to get sick, or they don't even check to see if they're sick. But this would really, really help a lot of people who just didn't know that this was available to them. So that's why I said make sure you're paying attention even if you have insurance, because you never know what will happen in the future and what services are being offered that could potentially or literally save someone's life here.
Yeah. So, you're going to become the ambassadors for us, if you will. And you are going to be the angel for someone, because someone a neighbor, a relative, a coworker, someone doesn't have any way to get appropriate health care, and you're going to be their angel.
Yeah. Yeah.
Okay, that's what I wanted to tell you about the two medical homes. And all you have to do is call and say you need help. There are just a few things that you need to bring in order to enroll, and that's a photo ID, social security card, and if you're undocumented, that's all you have to say is, I don't have a social security card, and no questions asked. We welcome everyone.
Yeah.
And then the third piece that we need is some proof or verification of your income for the year. So that's it. We take everyone. So our clinics are full of Hispanics and Blacks and whites and Asians. So we have people from Afghanistan who have settled here. So I see this question. It's a great question. These are adult clinics. So I'm sorry, they're not family clinics. So it's beginning at age 18.
That's a
And
good question. Thank you.
yeah, that was a great question. So 18 and above, most of our patients who are United States citizens leave at 65 because they're eligible for Medicare. But a lot of our undocumented people stay with us into their 80s until they die. And we're very happy to do that. Okay. Thank you for that question. That was a great question. So we have two community centers. These are also free. So the African American Center is on Abercorn. It's located on the same campus as the Georgia Infirmary. St. Mary's Community Center is located in the Kyler Brownville area. Actually, it's both of these centers are attached to or near very historic African American happenings in Savannah. So the African American Resource Center, Georgia Infirmary, was the very first hospital in the nation back in, I don't know, 1817 something, who took care of African American people. They were the first one in the entire nation. St. Mary's Community Center is 2 blocks away from Charity Hospital, which was the first hospital in the nation, in the United States, who was staffed by African American doctors and nurses. And both of them were one of the first places to have nursing schools for African American women.
Oh, that's awesome.
So that's pretty cool.
It is cool. And the African American Resource Center is not very far from the front porch. I just want to mention that because a lot of people come to the front porch to pick up items. You can go right up the street if you need to the African American Resource Center as well.
That's great. Thanks, Jennifer. Okay, we just shortened, because that's a long string to say. We just say the AARC, the African American Resource Center. So the two main things that this center does is they focus on healthcare and they focus on computers. Now, the healthcare that they focus on is not providing care for the providers. St. Mary's is 6 blocks away. So what the African American Center does, they focus on education, health education. So everything they do is to try to give people more information about how to care for themselves, how to get to the right places they need if they have an issue. So you'll see here, these are some of the things that we do. So we have classes on diabetes, high blood pressure, women's health. A big one that's coming up in the new year, we've had a big request for, now you all are too young for this, too young, but believe me, when you get a little older, you'll be happy to know about menopause.
Oh.
But some of our
People have early menopause.
yeah, some of our late 40 and 50-year-olds are saying, please, please, how do I deal with these symptoms?
I know. I was
So we're
at a presentation the other day, and when the lady stood up and she was giving her speech, and she said, "Oh, I'm having a hot flash right now." Yeah.
yeah. So we also do some screenings and things at the African American Center. So we have this cool thing. We have this, it's a camera, and this camera takes pictures of the back of your eye. And we can tell if you are having difficulty with an eye disease. It costs nothing, but we can tell if you have diabetic retinopathy, macular degeneration, glaucoma, if you have cataracts. Now, if you're a diabetic, some of those things are very, very possible because diabetes, just the longer you have diabetes, the more likely you are to be at risk for some of those eye diseases. So we want to make sure that people in the community have that access.
Yeah.
Now, I will say both community centers, it doesn't matter if you're uninsured or insured, all of these services are available to you. We offer hearing screenings and hearing exams, depending on needs. So we partner with the Savannah Speech and Hearing Agency, and they're just wonderful. So if you're having trouble hearing, you notice some things, depending on your age and what's happening, we either offer you a screening or an exam. And the good news is, if you need hearing aids, you just think about it as, if I'm a diabetic, I'm going to take this medicine so I can feel better. If I have hypertension, a high blood pressure, I'm going to take this medicine so I can feel better. If I can't hear, I'm missing out on conversation.
Right.
I'm missing out on being a part of the group. And so hearing aids now today, you can't even see them.
Yeah.
And the Savannah Speech and Hearing help you find the right hearing aids for you, depending on what your issues are, and they help finance them. So if you have health insurance, they work with your health insurance. If you have none, oh, yay, look at this. So Savannah Speech and Hearing also does classes to help children. So it's a wonderful place.
Awesome.
So even if you don't have money and can't afford hearing aids, they will help.
Oh, Frida, can you hear now? I thought she was making a joke, but can you hear us now, Frida? All right, I might have to check in with her. She said she couldn't hear us.
Okay.
I made that joke last time, but I was like, I think she's serious. Okay.
So we have several kinds. We have chair yoga. We have a meditation class to help with stress relief. And we have a class for moms who are pregnant. And we have people from Medical College of Georgia and the health department who come. It's just important that you know what's happening inside your body. And it's also a delight to know. We all get excited when somebody says, oh, and Melanie, right now, this week, your baby is developing eyelashes. And then we all get all excited. So, there are good things that they have around health. Okay, Jennifer, let's go to computers.
Okay, I have two questions before we go.
Oh, okay,
One is
go.
related to diabetes, and the other one is related to the chair yoga and different classes, in case I forget the second question. So the diabetes. So I know you say you do the free
Glasses.
the blood work. So for instance, if
That's in the clinics.
that's in the clinics. So if they get that free blood work, which I want to emphasize getting your blood work done, because you may not even know that you're diabetic because you haven't had blood work done. So I get blood work done every 6 months because my dad died from diabetes and I'm trying to lower my A1C. But I have to get it checked regularly to see is it going up or is it going down? Because I don't want to be, I'm pre-diabetic. The number is
Yes,
going down right now, but that's because I check and I've done things to change my lifestyle. But if they wanted to get the blood work, you will also screen and let them know like where their A1C is at so they can know if they're diabetic or not. Okay, great.
yes,
So I just wanted to make sure because some people are like, "Oh, I'm not diabetic." Well, do you know, like, when's the last time you had blood work done? Get your blood work
yes,
done and make sure you're not pre-diabetic or you don't have diabetes because diabetes can complicate a lot of things. For instance, like that's what I mentioned with my dad. I think he ended up getting COVID and the complications with that mixed with diabetes and everything else he had. I think it was a lot. But if you don't know that you have that going on, it's even worse. So I just want to put emphasis on getting blood work done if you haven't had it done. And then the chair yoga classes, if they wanted to do that, is there childcare provided while they're doing that? Or can the children, how does that work if they have children, but they want to come to chair yoga?
we have, so if you have little babies,
Mm-hmm.
um, we do a virtual with
Oh,
pregnant moms because
yep.
we found that the moms who are pregnant or the moms who are in their first year of the baby's life, it's too difficult for them to come to class. So we also do it virtual. So you could just stay at your house um, and join in.
Okay, very
Um, if you have older children, they want to do it too.
Yeah, yeah. I think they should. Okay, that's great to know. So older children can do it, and then if you have younger children, you can join online, much like what we're doing right now. Okay, great.
All right. Then the other big thing that they have are computer classes. So we have beginner classes where it starts off very basic information. And then it moves into intermediate classes. So, for example, in the beginner class, there's an intro to social media. So in 2026, there will be classes strictly on Facebook. So it's all kinds of, you know, a lot of people want to be on Facebook, but are a little afraid about how do they protect themselves. So all of that is included in the class. They're all for free. So there's going to be a class on Facebook and TikTok, what else? Instagram, things like that. We're also having classes on, it's called Canva. And Canva is a software that you can make flyers, you can make cards, you can do all kinds of fun things. We're going to work on how do you make a playlist, because some people don't know how to do that. So there are important, what I would say is basic level information that you get, but then also fun things that you're able to do. Okay. Now, St. Mary's Community Center. We are in Tyler Brownsville. We're one block in from 37th and I-16. We have a wonderful young woman who is an accountant, but she is also our career coach. We call her our career and money coach. So she has actually three big jobs, but so we're focused on helping people not get entry-level jobs through, you know, McDonald's or fast food, or even working in the hotels. Uh, we are focused on getting people career jobs,
Right.
jobs that you have a ladder. So you may come in at entry level, but then you work yourself up to a higher level and a higher pay. So that's what we're focused on. We are working with some trade unions, and we're working with Savannah Technical College to connect people to those classes. People don't realize that there are apprenticeships out there.
Mm-hmm.
So an apprenticeship means that what happens is people join apprentice, they get paid for doing the job and learning on the job. So a lot of the trade unions,
Mm-hmm.
an electrician, you get hired sort of as you know, a helper for an electrician. But for the time that you are the helper, you're learning how to do all different kinds of things. At the end of the apprenticeships, then you become certified, at a professional electrician, a professional welder. So, and then your salary jumps dramatically.
Right.
So, we apprenticeships, you can probably look at a starting job as you're learning in the $20-$25 range. But then when you become a certified professional, all of a sudden, wow, do they jump to 40s and $50 an hour. So these are really worth it. So if you know anybody who's looking for jobs, these aren't jobs, these are careers.
Right. Right.
We want to get you in places that you can keep moving up and keep getting higher salaries. So that's one thing that Shauna does. She's also, because she's an accountant, she does money matters. So this is like, you can call her or you can make an appointment and come in with any money question that you have. So, some of the things that people asked her about, I'm getting a new job. How do I fill out that W-4 so I'm not going to owe the government at tax time? I want a refund. I don't want to owe. And she helps them do that. People say, should I let them take money out of my account, or should I pay my bills online each month? So she talks through that with you so you are comfortable making the decision. So all these things, she doesn't say this is the right way or this is the wrong way. She gives you options and you make the choices which are best for you.
You have a couple
Okay.
in the chat.
Okay, good. Go
So,
ahead.
Michelle says she definitely needs the computer classes. We're going to share Sister Pat's information. You want them to email you, Sister Pat, or is there a place on the website to sign up for computer classes?
If you could take the shot of just the first shot of the two clinics and the shot of the two community centers, the numbers to those particular centers are right there. If
Okay.
you call St. Mary's or you call African American Center and say, I want to sign up for a class, once you give us your email, we send you every month a list of all the classes, because the classes rotate. So it's
Yeah.
not the same ones each month.
Okay. So I'll send the presentation, or I'll
Great.
send a link. Like, this is being recorded, so I'll upload it to our YouTube page and put it on the RSVP page. So if you don't see an email, just go back to the same page you RSVP at, shelterfromtheраin.com/backslash RSVP. It'll be there. But I will try to make sure everybody gets that. But all the contact information, or you could just honestly, Google St. Mary's Community Center or the African American Resource Center. You could Google that right now and save the number, but I will have it up. They also ask, do you still do apprenticeship for cosmetology?
I don't know that specifically, but if you call St. Mary's and ask for the career coach,
Yeah.
Shauna will check into it for you.
Okay, call St. Mary's, ask for the apprentice coach. Okay, great. And then Jasmine says she needs an apprenticeship after she graduates. So she would probably do the same thing. Just contact St.
Yep,
Mary's. Okay.
just call.
Yeah.
Because what Shauna does is she meets with you and she talks about your skills and what you would like to do, because whatever career job you choose, you want to be happy
Right.
or you're not going to stay. So you want to do something that you enjoy. So she helps you figure that out.
And that makes such a big difference. Y'all have heard me say this before. Having a job to pay the bills, like we all have that. Like if I have to do something, like we all have been there and had jobs. We have to pay the bills. And sometimes you have to combine that with other things too. But when you have a job that you actually really like, it improves your quality of life so much. And you might not notice it, but it affects your kids too. Like if you have a job
Yes.
that you're doing every day, your mood's going to be better. You'll be like more likely to encourage them to do things that they like to do. So definitely, even if you have a job that just pays the bills right now, look at the job that you actually really enjoy doing. All the things that I do, I have done for free. The things that I get paid for because it means I value the work that I do with Shelter from the Rain. I value the work that I do with Freshworks Media, helping people. And that makes a difference in my quality of life because I do things that I really feel like have value for other people and for my sense of purpose. So make sure you look into that. Like, even if you didn't think about it before today, I mean, it wouldn't hurt you to just go, talk to somebody and see. That could be your pathway to figuring out what you really like. We've had several moms that didn't know. They're like, I don't know what I like to do. Take some small steps and see. You might really find something that you're good at that you didn't even know you were good at. All right. So St. Mary's, I know Michelle said she did screenshot that page. And like I said, I'm going to upload this to YouTube and put it on our website. Need to go back to any of these pages. We'll have that contact information. Or like we said, just Google St. Mary's Community Center
Yeah.
and like don't use waiting on an email to get started. Like Google
Right.
stuff and go ahead and get started for
Amen.
yeah.
Just call and ask and we'll put you to the right person.
Yep.
Okay. We also do taxes. Now, I can't stress this enough. So many people pay to get their taxes done. That's your hard-earned money. You worked hard for that money. You need to keep it. So these are all free. We have between 25 and 30 volunteers that help us each year. We are trained by the IRS. We have to take tests. We are certified. So you're not just getting somebody who doesn't know what they're doing. These volunteers know what they're doing. They've passed the test or they can't do it. So in the last 20 years, we have done about 600 and some people each year have done their taxes, and we're always around the $1 million mark in refunds. So it's important. When you get your refund, you get your whole refund. Part of it doesn't have to go to H&R Block or Jackson Hewitt to pay for them to do it. You get to keep it all. I will tell you two big things about this coming tax season, just so you are aware. Because of the government shutdown earlier, the IRS is behind. So they have notified us that taxes will be late. So instead of tax season starting in January, it probably won't start until at least February this year. So just so you know, tax season might be late. The other thing is, for the first time, the IRS is not going to be mailing checks to anyone. From now on, you must have either a bank account, a checking account, or a saving account to do a direct deposit to your account, or you must have a debit card from like Chimes or somewhere that you can put your refund directly on that card. So you're going to have to make sure that you have those things available when you come to do your taxes. Okay. Public benefits. We are the largest public benefit partner of DFACS, and we do walk-ins and new and renewals. When you do them with us, you can come back to us because then we can see your activity and your things because we have access to the software and you are in it because you initially did it with us. We can check on things that keeps you from going down to DFACS. So it does make a difference. We do usually between 3,000 up to 4,000 applications a year.
Wow. Anybody have any questions before we keep moving forward? Because we've covered a lot of stuff. We're almost to the end. Does anybody have any that they want to ask? Oh, let me check the chat. I agree so much. I took a pay cut in education. Okay, yeah. I think these are just feedback. Okay, Frida's volume is out again. Just hang on. Figure out. Okay. Okay, good. So everybody, this is interesting. So I don't think there's any questions, just mostly comments.
Okay, great. Okay, another thing that we do is eye exams and glasses. So if you're uninsured, we help you with an eye exam and glasses. If you have Medicaid or some of the other insurances, they will pay for an eye exam, but not for glasses. So we'll tell you where to go to get the eye exam that the insurance covers, and then you come back to us for glasses. So some of you might have employee health insurance, but you don't have a vision plan because health insurance is one thing that you pay for. And then usually vision and dental, you have to pay extra to have those. So if you have health insurance, but no vision insurance, you can come to us and we will help you. All right. So you'll see those are three of our partners, Georgia Eye, Lens Crafters, and Georgia Lions. And so after we find out what, if you are uninsured or what kind of insurance you have, we will send you to the correct place to get eye exams and glasses through the Georgia Lions. Start at $15. But again, you know, depending if you want tint or you want them to be transition and things, all those kinds of things are extra. But if you're just getting, you know, regular glasses, they start at 15. So not bad.
Not bad at all. And I'll just mention in this group, because I mentioned it in the presentation we had earlier this week. I get my glasses from Zeal. So if you get your prescription, like if you come here and get an eye exam and get your prescription, you still need to get that done. But if you get that done and then you get a set of glasses from here and you want more, very similar to how they're set up. It's a very low fee for the frames, and then you pay more for, like, I have to have blue light protection because I'm looking at screens a lot, but it's still like, I don't think I've ever paid more than 40, maybe $50 for all the stuff that I've added to this. And before I was paying like $200-300 with insurance for glasses, and it was really, really bad. And I could only, and if I lost those glasses, I almost like lost my mind because I couldn't afford
Yes.
to buy.
Yes.
So yeah, but Zeelol, Zeelool is also another option after you get your prescription. But this is a great option if you just want to go ahead and knock it out. Because Zeelol, you have to do it online by yourself. But this would be great if you just want to knock it out and get your glasses. Is this for children as well, or no? This is just adults.
Most of it is for adults, but lens crafters will take children. I think they have to be above 5 or 6 years old, though, because they don't have the pediatric doctor there to be able to do it.
Okay, yeah, that's still good. 5 and above, because you just don't want to you want to make sure the challenges that your kids have, it's not because they can't see. So definitely get the eye exams and make sure that's not something that's hindering them because they might not even know that that's a
Yes.
problem. Like get an eye exam so you can see, oh, that might be a problem for them. Because I didn't think I needed glasses. And then I took a test and I got glasses and I went outside and I was like, this is what it's supposed to look like. So you might need to make sure your kids also know what it's really supposed to look like. Okay.
Okay, and then when you come, we have resources and information for all kinds of different things all over, mostly the Savannah area. We don't have things outside of Chatham County. Most of the information we have is right here in Chatham County, but we have a number of food pantries so that you can go to a church, a different church every day of the week and get a bag of food if you need it. Places where you can go to get meals. So all kinds of things to help you with documents, to help you understand what your documents say. We have a notary this is all free. A lot of people have problems with Social Security. How do they get this or whatever? We help with all of that. So if you have questions, come. If we don't know it, we're going to research it until we find the answer for you.
Awesome. Okay.
Okay, and then just, we always want to grow. We always want to learn and grow with you. So if you have ideas or things that you need that we do not offer, we're very open to hearing your needs, your wants, and seeing if we can indeed make it happen for you.
Yeah. So does anybody have anything else that they might need that we didn't cover? What I really love about Sister Pat and the St. Mary's Community Center is they cover so many bases of things that our families need, from health to career development to even just engagement with other people. The chair yoga, like there's a lot of different things here. Like I'd be shocked if you can find one thing that you could do with them. But even though we mentioned a lot of things, is there anything else that we did not cover that you need help with or you would like support with?
Yes.
You can come off of mute or you can put it in the chat and I'll read it out loud. We're right at 12:12, which is great. I wanted to end before 12:30. So we're not on a crunch because I know we've gone to 1 o'clock before. Does anybody have anything else that they're dealing with that they need help with?
I had a question.
Yep.
So to take advantage of these resources like the vision and the apprenticeship, do I have to be a member or anything or fill out anything?
No, ma'am. All you have to do is come and meet with the people who are doing whatever the different areas you're interested in. And they will take it from there and set it up and help you work it.
Okay, thank you.
Awesome. And I'm going to leave this screen up if you need a screenshot this information. But again, you can just contact St. Mary's Community Center. Okay.
So Jennifer, I just saw a question pop up in the chat and it was about mental health.
Oh,
We do not have mental health therapy sessions right now, but I will tell you a group that does, and it's it costs a little bit, but it's only a little bit. It's called Hugs.
yes.
You know Hugs?
Yeah, we
H
partner with
U
her. Yeah, go ahead.
HUGS. And it's like $25 a session, and they're really, really great.
Yeah.
So the two free clinics partner with Hugs.
Yep. And we partner with Hugs as well. You just have to be in our mentorship program. We'll pay for 10 free sessions for that. But if it's a crisis situation, let us know. But I have a Hugs counselor as well. They're great. I've worked with Hugs for a number of years. There's very few services that we partner with that I haven't tried myself first because I don't like recommending things to moms and the customer experience is not good, but Hugs is great. I was just in there Friday getting my therapy session yesterday. So they really care about making sure
Yes.
people get the mental health resources they need. Thank you for bringing that up because mental health is huge.
Yeah.
Yeah, Hugs, if you look them up, you can also Google them. If you go to the Hugs, it's Heads Up Guidance Services. If you go to their website, they have a tab that says individual, like services, and then individual services. You can sign up for a 15-minute consultation, and they will set up an intake service for you. If you have any issues, email me and I can make sure you get that information. But literally, you could go to their website right now and get that information. I've even referred our team members to Hugs if they
Mhm.
everybody right now, there's a lot going on. So it's not
Yes.
like a lot of people are struggling mentally with a variety of different things. So if you need help, don't be ashamed. Reach out and get what you need. If you want a very specific counselor, you can ask for what you need. I always try to tell our moms, they're like, oh, well, I can't ask for specifically what I want. If you want a very specific type of person to be your counselor, then say that. If they have that, they have team meetings to fit people with what they need. So like I know there was a period of time where I needed a African American spiritual person and I asked for that and that's what I got. The person I have now is totally different. So like what I need right now it really doesn't matter. It's more grief counseling. But whatever you need, you can say that. So make sure you get what you need, and you don't always have to go with the first person either. I always tell moms that if you meet somebody and you're like they're nice, but I don't really like, you
Click.
tell them that, you're nice, but I think I need somebody else. And you can find the right therapist. And it may take two or three times, but find the right person because you're going to be sharing some of the most intimate, vulnerable, scary things about yourself, and they're going to help you unpack those things. So make sure you find somebody that you're comfortable with, feel like you can grow with. So thank you for the mental health. That was a great question.
Yeah.
Does anybody have?
Jennifer, thank you for the follow-up because that's really important.
Yeah, absolutely. Okay.
I
Somebody
have one more
said,
question.
okay, go ahead.
I wanted to ask this. My mom, she has stage 4 bone cancer, and um it had spread. Now the bone cancer spreads to different parts of her body, so now it has spread to her spine, and she needs a wheelchair. And I was wondering if you guys offer like if you have any wheelchairs or anything like that.
So if you can, so does your mom have health insurance? Does she have Medicare,
Um, I
Medicaid?
I I believe it's Medicare.
Okay. I think if she goes to her doctor and she says to her doctor she needs a wheelchair, Medicare will pay for it if her doctor,
Oh,
writes the order for it.
Okay. All right. Thank
Try
you.
that first. And if that doesn't
Okay.
work, then call us at the community center and we'll try to find something for you.
Okay, that sounds good. Thank you.
Thank you.
and everybody, please screenshot this page with the information because you may think of something later you want to email and ask Sister Pat, and you have the information right here. But like she said, most everything we've talked about is on the internet. You can find it. You can just call on Monday. But I think we've covered everything. I do want to give a special thank you. I don't know if she's still, yeah, she's still on here. Jessica Hunter is on here, one of our board members. I saw her get on. I don't know if you can hear me, Jessica, but thank you so much for connecting us to Sister Pat. and these resources, because even when we presented with Georgia Southern, almost everybody was on, like they didn't even know about these services. So I think it's great that we've been able to kind of help a lot of different audiences with our Georgia Southern students, our moms. I'm going to put this, like I said, on our website. So hopefully other people will see these amazing resources. And like I said, some of them, like you might think this is a small referral, but this could really save someone's life, either health wise or even just community wise, helping people know that they're not alone. So I'm going to go ahead and stop sharing. I'm going to put the survey in the chat. So please, please fill out this survey so we have attendance for you. Like I tried to do a snapshot, but I know some people came on after I did the attendance for a snapshot or the snapshot for attendance. Do the survey so I have it and I can, like, when I look up your name, we know that you did this session, because my brain is not going to remember everybody that was on here. All right, so here is the survey. Do that one first, please. It'll take you 2 seconds. You don't have to write a novel. Just write if this was helpful. Write what other topics you would like for us to cover. And then once I see some coming through, I'll go ahead and put I don't want people to get confused by the links. I'll go ahead and put the link for the Christmas show. If you want to come to the Christmas show on December 7th, Sunday, for free, we just need an RSVP. All right, it's the 2025 Christmas show. Okay.
Jennifer, I have one more thing
Yep,
I
go ahead.
just thought of.
Yep.
So on MLK Day in January 19th, you'll see a banner in the parade with St. Joseph Candler.
Mhm.
So we're having a special day at the African American Resource Center
Mhm.
on diabetes. So
Oh,
everything is about diabetes. So you can get your blood tested and
oh,
know what your
yeah.
A1C is.
Yeah.
You can go just stop at different, you can get your eyes tested that day.
Oh,
They're gonna do foot care. And we're gonna have a whole bunch of things that you can win. Diabetic shoes,
um,
and you get to pick out the shoes you want.
oh,
So all kinds of good things happening after the MLK parade from 1 to 4 on January 19th.
that's great. Um, yeah, that's excellent news.
And all free.
Everything's free. But no, diabetes is huge, y'all. Like I know I keep reiterating it because it's so personal to me because of my family. But like if you can catch that and really try to take care of yourself, like my dad did, he really tried. The harder he got, the harder it was. But taking care, like knowing what you're okay, great. I don't see anything coming through yet, but I'm hopefully these surveys are coming through. All right, let me reload and see if any of them have come through. I'm gonna go ahead. After I see a couple, I'm gonna go ahead and put the link for the Christmas show in here. I don't know why I don't see any. Well, it's still loading. But anyway, huge, huge, huge. If you can get that checked, and the foot care is really important too, because my dad had really bad neuropathy and he couldn't feel the bottom of his feet. So what really took him out towards the end was he had a nail that went into his shoe and went into his foot, and he was putting his foot in the same shoe every day and couldn't feel it. So he's walking basically on a nail. And finally he went to the doctor because like things were happening and there was an infection in his foot and he didn't know. He went in, they said they were gonna check and see how bad it was, and he woke up without his right foot, which was devastating. So make sure you take care of yourself. Make sure you get to a point where you don't have to have situations like that. I don't know why I don't see any of the let me see if I can look online. I don't see any of the forms coming through. Thank you, Heather.
Heather, I'm glad. 13 to an 8. Good for you.
Yeah, that's
Okay.
amazing.
And we can help you get from an 8 down to a 5.
Yes, absolutely. Okay, I'm gonna go ahead and put the link in there so y'all don't have to keep looking, but no, that's wonderful. Okay, she says she just did hers. I'm gonna try to make sure. I don't know why I don't see them, but let me check my phone. Maybe they're coming through slower on here because I'm gonna check and see if I can see. I don't know why I can't see any of them. I just really like to have these because it's easier with attendance. And sometimes we have issues with the forms coming through. So if you can try to do them through Google Chrome. I'm gonna try to see if I can look through the website because sometimes for whatever reason they don't come through. I can do it. I think it's my Wi-Fi. Okay. I will, if you have any issues, please email me because I'm really not, usually I see them come through immediately and I don't even see the forms coming through. Let me see if they're showing up on the website. But anyway, I'm going to end the recording. If you have additional questions, you can stay on. But for those who are watching online, you can definitely send a survey on our website if you want to. It's the link. I think the link on our website, you have to look at the top. It's under events and then survey. If you want to give us a survey about this group. And then if you have any questions, just email Jennifer@shelterfromtherain.com. All right. And thank you again, Sister Pat, for this amazing.
Oh, listen, thank you all. It was great to be with you. And thank you for the joy of those babies.
I
What a gift.
know. Such beautiful babies. All right. So everybody online, we'll see you later. I'm going to stop the
Happy
recording.
Thanksgiving. Blessed Christmas.